Hello, everyone. Welcome to Building Our Village with Tender Care PPEC. We are here with Jennifer from Allegra Family Pediatrics. How are you doing, Jennifer?
Hi, how are you, Aurora and Thomas? Thank you so much for having me.
It's our pleasure. We're happy to have you on.
Definitely. So, we're just going to dive into the first question. How did you start your practice?
So, starting my practice for me was a significant and heartfelt decision. After years of working in corporate medicine, I felt like a disconnect between the care that I wanted to provide and the constraints that the corporate model were giving me. And the emphasis was in high patient volume and it was impersonal. So that impersonal nature in the healthcare system it didn't align with my vision. So I wanted to bring a different care, a different model. So I decided to open my practice, leave corporate medicine, and bring back that traditional approach where one doctor sees and knows their patients. And this approach fosters deeper connections. It's easier for a family to actually open up to me. I can spend more time with each patient. I can know their unique needs. I can identify more like issues, and I can create this family friendly environment. Then the children can feel comfortable with me, the parents feel comfortable and confident in the care that they're receiving. They know they're not a number in a big practice, they are a patient in a practice that actually serve them with attention and everything they require and they deserve.
I love that aspect, and I'm pretty sure, after we met and talked, the first thing I went back to Aurora and said was that aspect, how they're not just another number to you. They are a patient. You truly care about their outcomes. And I told my wife the same thing. I said, because that's refreshing. You don't get that personal touch anymore in medicine. Everything is a number. Everything is, it's scheduled this or that. You don't get the time. You don't get the ability to really understand your patient's circumstances or what their needs are. So when you take that time and give that personal touch, it makes a total difference based on the child, the family, and everybody involved.
Yes, that's sad. Medicine is such a noble profession, and pediatrics is just so fantastic that it should be practiced this way.
Mhm.
Unfortunately, not everybody has the opportunity to practice it in this type of model, but I believe if more doctors want to bring this model back, we can bring it back because it's just too good to just let it be what it's becoming. So,
Because at the end of the day, you're really you're caring about the outcome and the
yes.
patient. It's got that personal connection where that's being lost in not just medicine, but everything today. Technology is great, but it's also disconnected that personal connection.
Exactly. That's why I want to bring that one-on-one, family-friendly, consistent environment when they can feel heard, understood, and genuinely cared for. That kids can ask questions, they can feel validated, and parents don't feel dismissed. That's something very dear and important for me.
That's huge, and I think that's going to take you a long way.
Thank you.
Um, the other aspect of your practice that was so impressive was the way you set your clinic up and the how beautiful it is on the inside and all of the lights and the little things you did throughout the center to really make it comfortable and inviting. Could you tell us where you're located and where your
Well,
new practice is?
the practice is in 4651 North State Road 7 in Coconut Creek. It's kind of between Coconut Creek, Coral Springs. It's very centric, close to West Boca, Coconut Creek, Coral Springs, Margate, Parkland. So it's very in the midst of it. It's in 441. It's very reachable, accessible for all the points.
I love that you chose a central location to be able to touch
Yeah.
those families.
And it's also close to my house and my children's school. So that's something that is
But
very nice
you've
because
got
I'm a
you've got to keep
mom.
that
Yes.
you
Above
got to
all,
keep
I
that
am a
family
mom.
dynamic
So
in order as well.
yeah. Yes.
Yeah, that's great. So let's dive into some more deeper topics. So, what are the key reasons parents should take their child to a pediatrician?
So I think parents should take their kids to a pediatrician for several key reasons.
Mm-hmm.
First one is preventive care. Regular checkups allow the pediatrician to monitor their growth, their development, administer vaccinations, and provide preventive care to keep the kids healthy, to avoid them getting sick, right? Also,
Mm-hmm.
early detection. We as pediatricians are trained to detect and diagnose health issues early. And that early diagnosis can be can lead to a more effective treatment and a better outcome for the kids. Developmental monitoring, that's another reason why. Also, specialized care. Sometimes there's children that need something extra, uh, need more specialized knowledge, and we are able to refer illnesses, nutritional needs, behavioral issues that we can tailor. When you bring them to the pediatrician, we can redirect in case we need to send to another physician. Also, the management of chronic conditions, of course, health education. That's very important because we as pediatricians, we're valuable in giving advice and guidance. Parents don't need to do this alone. Okay, just because they can doesn't mean they have to. We're there for them and they can use us as resources. Health education is very important. Also, building trust. When you have regular visits to the same pediatrician, you build that relationship, that kind of, like, the kids know you, they're more comfortable, they're at ease, and as they grow, they can actually grow to be trusting with that pediatrician, and they can speak with them when they're teenagers. And also general support for parents. We're there to support the parents, and we're there to identify and help them navigate all the challenges that is raising a child.
I love that reason, and when you build that trust, you open up that communication line, and when you have good communication, you know the ability to make a difference is better because then you can really foresee the problems or understand the issues that are going on. Um, how often how often should a child have checkups with their doctor, and what should parents expect during these visits?
Basically, a newborn visit within the first week after birth, and then at 1 month. And what do you expect on that visit? Well, you have to check the growth, the weight, the length, the head circumference, the reflexes, and the overall physical development, and anything that could have happened before, during, or after birth, immediate birth. Also, feeding and nutrition guidance of breastfeeding, formula feeding, all of these things that a mom will need support with on that critical newborn and infant visits. The infant visits are at 2 months, 4 months, 6 months, 9 months, and 12 months. During that critical period, we do vaccinations, we do the developmental milestones, the assessment on that critical infancy period from 2 to 12 months is crucial because there's a lot that we can identify in those, like, and that can change from 1 month to another month. So it's very important, especially the developmental milestone, the assessment of the motor skills, the social interactions, the language development. Also, health screenings, conditions like anemia, hearing issues, vision issues. Also, parent education, very important on that infancy period and what to expect on the oncoming months. Also, we have the toddler visits. Those are 15 months, 18 months, 24 months, and 30 months. In that piece, of course, we do the physical examination, very crucial for growth and physical development. But developmental assessment is very key, especially because around that time is when we do developmental tools like the MCHAT, the Modified Children Autism Checklist. We do evaluations of language skills, social behavior, motor skills. That's very crucial around that toddler phase. And the parents needs to know that it's not only because of the vaccines, who also need to see what's going on in the development aspect of it. Nutritional guidance. That's when the picky eating starts. And then if you can catch that early, we can help them guide the parents better. Behavioral assessments and tips to how to like navigate the terrible twos, the tantrums, and all these things. Then we have the early childhood visits that's the 3, the 4, the 5 year visits, same thing, the physical examination, developmental milestone, entrance in school, pre-K, things like that are very important. Safety on that health group. They're very rambunctious on that age group. So we need to do a lot of safety advice,
I
injury
understand that.
prevention, healthy habits, screening guidelines, especially at that age. They love their iPads and their phone. These things, like, we can do that. After that, we have the school age from 6 to 12 years. Same thing. We do the physical examination, the monitoring, the academic, the social development, the vaccinations, the health screenings, the conditions like scoliosis, eating disorders, things like that are very important on that critical school age. And then the adolescent visits, of course, from 13, let's say, to 18 or 21, where we actually prepare them for adulthood. We guide them into transitioning to being adults, to foster the independence and the health management. They're gonna go to the wild. They usually, when they go to the adult doctors, they want to come back because they will be
Mhm.
baby like we do. But it's very
Mhm.
important that through all these stages, the parents know that it's super crucial that we see them in, because every stage has a very meaningful and impactful tool or detection or anything useful for them to for us to bring them to the office and guide them through.
That was fantastic how you explained that, because in my mind, oh, I'm just going for a checkup, or I'm just bringing them for a checkup. But when you put it in the aspect of, we're checking at these times for this to make sure this is going, as well as parent education, and how, it ramps, kind of, it starts with a lot of visits and it slows down. But now you kind of understand the need at each point of those visits and why they're important.
Yeah, every age have their special flavor, as I like to call it. When
Right.
I am seeing a 2-year old, it's not the same thing that I'm seeing in an 11-year-old. And the benefits, like, okay, it's a checkup, but what type of checkup? And the parents should be cognizant of what they should be looking from their pediatrician at that checkup. Like if you're 11 and your kid hasn't been checked for scoliosis and he's growing fast or she's growing fast, we need to ask. We need to advocate for our own children and have your voice and your concerns heard at every age. And that's why it's very important that they come to the office and they visit their pediatrician.
And I think, as we talked earlier, that aspect is lost. Like, it's just another, like, it's just another, like, formulation. Like, they've got to go for this for school, but the reason behind it is not always
Yeah.
explained.
Yeah, it should be. It should be
Yes.
because parents
Yeah.
should be in the know of why they're doing these things. The American Academy of Pediatrics has brought these policy statements and the Bright Futures, the ages and stages, all of these groups have designed these protocols so we know how to find, how to identify, and how to early treat and detect these things. So that's why every age has their own need to be addressed.
Yeah. And I also just want to add on to that. I love how you explained, each milestone for each age, because I also feel like parents are just overwhelmed to take their child to the pediatrician, or it's a hassle, or they think of it as a hassle. And I just really like how you explained it, because you're really trying to help the child and the parent. Like, it's not something that's a hassle, or oh, you just have to do it because of school. No, you're trying to help them. And I just really liked how you explained that.
Oh, thank you.
Yeah.
So, with all that said, you touched on it a little bit, but can you go into, and explain why early diagnosis and intervention, what that means and how that can affect the child's health?
Oh, definitely. Well, early diagnosis and intervention in the context of children health refers to timely identification and treatment to any developmental, physical, mental, behavioral health issue. And I make the emphasis on timely because when you address something with time, you're able to fix it quickly. Early diagnosis, for example, involve identifying issues at the earliest possible stage. This can be achieved through regular screenings, for example, as we were saying, routine checkups. They help detect things as simple as hearing, vision, and developmental delays and chronic illnesses. And monitoring developmental milestone, that's a very key ingredient for all the pediatric visits. We monitor growth, speech, motor, social interactions, all these things. When anything deviates from the typical development pattern, we are able to catch it early. We're able to get it on time and appropriately treat on time. Parental observations. When the parents tell you something, 95% of the diagnoses are made by the parents' observations. Make sure that if there's any little single thing in your child behavior that you're concerned, bring it to the attention of the pediatrician because that's early diagnosis. Now, early diagnosis, we encourage the parents to bring it to our attention because the time I have with the kid is not the same that the parents have them at home. So when you see something on your child, please bring it to the pediatrician attention. We will listen. We will make sure that we make an answer to whatever question you're having and early diagnose. Now, early intervention refers to the strategies and therapies that are implemented as soon as a diagnosis is made to address those issues that you identify. This can include like therapeutic services like speech, occupational, physical, other type of therapies that can improve the delays and the skills. Medical treatments, of course, let's say medical conditions that we can detect early, diabetes, asthma, all of these things we can detect early, we can treat early. Behavioral therapy, and also parental guidance and support. Because when you have early detection and early intervention, not only you're benefiting the outcome because you're treating early, but you are like setting that kid up for improved outcomes. When you treat early, you significantly give the kid a chance to catch up with their peers and have long-term better outcomes. You also can reduce the severity of a condition if you uh, are able to catch it early. Because if you address something regularly, you can prevent it to becoming something severe or leading to additional complications. Also, you can enhance their development because if you have a kid that is lacking in one area and you support it, that physical, emotional, and cognitive development can be even enhanced. If you catch something that is deficient, you don't let everything else to fall in the same category of deficiency. And family support also is cost effective. Early intervention in general can reduce the need for more intensive and costly treatment. Also, invasive treatments in the sense of health needs. So, you're avoiding getting more complex issues by detecting and treating early.
How you explained that was again amazing. You do such a great job, using your words to make us understand. And I like to look at it, and I've used this as before, like the early intervention. You're giving them the tools early to succeed later. So when
Yeah.
you put these strategies in place early, they can use them later on, or they might not have to, but then it becomes more of their daily routine, and they're able to understand, and you're able to get ahead of problems before they get
Yes.
worse.
Yeah.
Early diagnosis and intervention are critical components of pediatric care. That enable not only the healthcare system and the providers to address things promptly and don't let them go far so you don't have to like have even more things and complications that could be avoided by catching these things early.
That's so important. When you're able to, let's say, diabetes, if you're able to diagnose that early,
Yeah.
it's going to help later on down the road, where now it's becoming more common for these things to show up, and we can catch it earlier, we're able to help more.
Yeah. And you mentioned, I really like that you mentioned, as a parent, if you see something off with your child, it's very important to bring it up to your pediatrician, even if it's
Yes.
a thing, because you just never know what it could lead to. And with that, what are some of the common signs or symptoms that parents should watch for that might indicate a need for early intervention?
Like we can actually let's put them into categories, right?
Mm-hmm.
Because it's easier for a parent to be vigilant of these signs and symptoms that might indicate the need for early intervention. But let's just put them in little categories because I think it could be easier for the parents that are listening to us to identify if there's anything. Let's start with developmental delays, for example, speech and language. When you have a baby that is not babbling by 9 months, when you're not using a single word by 12 to 14 months, when the kid is not using two-word phrases by 24 months, that's a red flag, right? Motor skills delay, when a baby is not sitting by night or crawling by 9 months. not walking by 18 months, or have very difficult like fine motor skills like pincer grasp, is not getting those little Cheerios or those little like snacks with their fingers, or all of that should prompt an alert. It's not necessarily, not every child develop at the same. That's why we're giving ranges, right? It's
Right.
not like, okay, my 14-month-old is not doing this is wrong. But, there's ranges. So that's why, but we need to be, there's certain definites, like the ones I mentioned, that are very important for the parents to know. Cognitive delays, for example, kids having difficulty understanding simple instructions, and kids that don't engage on pretend play. What is pretend playing? Like you get a banana and start talking like it's a phone, like things like that. And also problems with memory and problem solving that you can identify in kids. That's in the developmental arena. Behavioral and emotional concerns, excessive tantrums, frequent, intense, and prolonged beyond what's typical for their age. Of course, tantrums are typical for certain ages, but when you can identify what a tantrum is beyond an age or extreme out of the bounds, parents know. So that's something to look for. Social withdrawal, avoiding interactions with others, not showing interest in playing with peers, or lacking eye contact. That's big. That's massive. The lack of eye contact is something that should always be prompt at least a conversation. Not everybody have the ability to have the same eye contact, but that's a big, big one. Also, inattention and hyperactivity, difficulty focusing on tasks, being easily distracted, or displaying excessive energy and impulsivity. Now, kids will be kids, and that is absolutely normal. Kids don't, they're not supposed to have an attention span after at certain age. But let's
Mm-hmm.
say a kid in school age, like 7 year old, 6, 7 year old, those kids, I'm not saying like your typical 4 year old, they don't, I mean, you can't expect them to sit to listen to something. So it's just the ones that are out of range for the age. Also, in the physical arena, we have chronic illness symptoms, persistent coughing, wheezing, persistent infections, unexplained weight loss, vision and hearing issues, when you're not responding to visual or auditory stimuli, when you have kids squinting, frequent ear infections, or not following objects with their eyes, when you have a kid that is not growing, that has poor appetite, that is not gaining weight, that have difficulty swallowing, they have this failing to thrive, or physical symptoms that they're not normal. They are definitely not normal, and they can be easily fixed, but some of them can lead to the diagnosis of something more severe. So that's never normal. So you always have to bring it to the attention of the pediatrician. Learning and academic issues, difficulty in school, struggling with reading, with math, with writing, not keeping up with classmates despite of doing efforts and despite the parents working with them. That's actually a red flag. And sensory concerns, kids that have over or under reaction to sensory stimuli such as sounds, kids that cover the ears like this, like with sounds, textures, lights, or movements. And when you have a child with unusual sensory behaviors, avoiding certain textures for sure, being bothered by things like tags in clothing, although that's not like, okay, if this tag bothered me today, I have a meet. No, I mean, have something to be that bothers them, that make them cry, that is actually noticeable. Seeking out intense sensory experience, seeking out vibration, seeking out touch, seeking out like being in your face, those type of things are red flags. Social interaction and communication, for example, lack of joint attention, no pointing or showing interest to the caregiver or the parents by 18 months. If a kid likes something, they will bring you to it and show you and point. And this like joint attention, when you want your parent to do something for you, you tell them that any way you can. If you cannot talk, you point. You so that type of like interaction is if it's not there by 18 months, is concerning. Repetitive behavior. When you have kids engaging in repetitive movements or activities, hand flapping, lining up toys obsessively. I mean, some kids are just organized. God bless their parents. That's good. They're normal kids for sure. But like they organize their toys. It's not like regular organizing. It's like the only way they can play is like by lining them up or putting them by color or things like that that it's not normal for a child. And also in the emotional and health, mental health area, persistent sadness or anxiety, showing signs of depression, excessive worry, things that can interfere, fears that interfere with the daily living, behavior changes, mood swings, aggressions that are out of the ordinary with a child. Those are red flags. Difficulty sleeping, trouble falling or staying asleep, unexplained or extremely frequent night terrors and nightmares that are not consistent with the developmental stage where the children are in the moment. And also when you have unexplained physical changes, skin changes, persistent rashes, unexplained bruises, changes in skin colors, digestive issues, chronic constipation, diarrhea, stomach pain, things like that can say there's something definitely off with this kid. And we don't know what could be, but we need to bring it to the attention for us to be able to get that early intervention and seek help. When you have a consistent concern as a parent, please seek help. It's important
Mm-hmm.
because especially also that I forgot to mention, when a kid has a regression, that's a big one. Let's say a child that loses something that he a skill that he previously acquired. That's crucial. That's immediate. Let's say there was a 18-month-old that used to speak, say mama, dada, other words, and they stops doing it. That's even more worrisome than never done it. Like when a kid is regressing, that's immediate. That's like, let's not wait a week. No, 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 no. That's immediate. A regression is very, very alarming and concerning and should be addressed immediately.
So
Wow.
I wish I could take this video and put what everything you just said along with that checklist you get at checkups, because you went into detail why like these things are important, and you're not just checking the list. Like I feel like this should be an explainer video to go along with the checkups you get for your children's visits, because you put it all in perspective and how it all works together and how like this affects this. And it's not just asking if your child plays with kids, it's asking, you're given the reason why that. So I just felt like that was, that was very informative and beneficial, like for parents to hear that. So you're not, like we've talked about earlier, when you go into that checkup, you're not just checking the boxes like, oh, I just got to get this done, but there's reasons behind it all, and catching those reasons. We touched on it earlier, a little bit, but I've witnessed firsthand the power of early intervention and how that affects the health outcome for the patient or the child later on in life. Could you go into a little bit more detail how that early intervention benefits later in the outcomes?
Definitely, early interventions have a profound and positive impact in the long term development of a child, the well being of a child. And you, in your amazing work that you do with children with special needs, you have seen how a therapy can enhance those development outcomes greatly. Let's just say physical development. Interventions as physical therapy can improve motor skills, coordination, and overall physical health. When you have like cognitive development, when you have early educational support therapies that can enhance those actually cognitive skills, including problem solving, memory, learning abilities, when you start that early, you can actually almost assure that this kid's gonna have a better outcome when school or any other like learning need arise. Language and communication, speech and language therapies are amazing. They significantly improve the ability not only of communicating effectively, but also to lay the foundation for the future development, reading, comprehension, all these things that are needed to be successful academically, all starts with language and communication. Also, early intervention can improve social skills, peer-to-peer interactions. Early social skills training help the kids how to like interact appropriate with their peers, fostering friendship, avoiding social isolation and bullying, and also that's a big topic in nowadays. Emotional regulation interventions, those early interventions therapies can teach children how to manage their emotions, and they can kind of tailor their behavior and control the behavior to have fewer outbursts. Academic success. When you lay the foundation, you can have school readiness. Children that receive early intervention are often better prepared for school with improved literacy, numeracy, and classroom behavior. Parents sometimes get confused. Oh, my kid's having a label because he's getting therapies. On the contrary, these therapies are actually setting the foundation for academic readiness and success. And also with the behavioral issues, early intervention tackles a lot of the behavioral problems later on. Also, you can increase independence, self-help skills. The kids learn how to do the dressing, the feeding, personal hygiene, and problem-solving skills for the daily living that when you do it early, when you do those therapies, you can actually help them to lay the foundation for their adult life. Emotional and mental health, very important issues that can impact their later self-esteem. Children who grow with these deficiencies, they get picked on because they cannot speak. They have like issues with the motor skills, and then that is important for us to it foster their higher self-esteem and confidence and give them positive reinforcement. Also, it has even economic benefits because early intervention can decrease the need for long-term special education services later on in life. That's cost saving for the families, for the school system, for the everybody. If you get this early, you don't need all these cost maneuvers that you have to do after a kid is failing academically. Also, healthier lifestyle. So let me point out some impactful interventions that like things that you guys do when you guys do firsthand. Speech therapy. Love it, love it, love it. Occupational therapy, physical therapy, behavioral therapy, especially ABA for applied behavioral analysis therapy for children within the spectrum. These are therapies that can make a big difference between a child that can succeed in spite of any limitation and grow and develop to a level of like almost the same as their peers. So early intervention is crucial, it's important. And if you have the ability to get it early, don't delay it. If the parents can get it, don't just wait it out. Oh no, he will improve. Boys will be boys. They're in a bilingual household. All of these things just only delay the treatment. They're detrimental for their outcomes. So early diagnosis, early intervention, great outcomes.
It, how you put that was great, and the one thing I took away from that is, can you come on with me with my next presentation at a hospital, because you really bring that aspect of knowledge and passion behind it. And I'm thinking, oh man, I need to bring her with me on my next presentation.
Take me with you. Take me with you.
Yeah. I just love how you explain everything. I mean, you said this is your first podcast. You need to be on more podcasts because you're
Yes,
Oh my God, thank you.
I
This is
agree.
actually my first podcast.
yeah.
Yeah, I wouldn't know that this was the first, and that you've never done this before, because the way you've elaborated and answered and communicated what the reasons behind everything, it's been fantastic.
Actually, I'm very passionate about this topic because this is what I do every day. This
Right.
is my daily basis. This is my every checkup. So for me, this is passionate. This is something that I believe in. And as a mother and as a pediatrician, it's something that I get to combine and it brings me joy.
I mean, what's the saying? When you do something you love, you'll never work a day in your life. So
Yes.
that's you're truly living it, and I love that. And I could kind of go on the same thing. I love what I do. I love the difference we make, and I have a passion for it. And I think that's how we made that connection that day in your office.
Exactly. Yeah. That was a great connection. I really love the way we both are crazy about kids in a good way.
Yes. Yeah.
In a good
Exactly.
way.
Exactly.
Yeah. Is there anything else that you wanted to mention at all?
Yes, actually, there's something that I want to address just as a let's say closing statement.
Okay.
Family involvement. It's very important that active participation in that early diagnosis and intervention. Also, individualized approach. It's not one size fits every kid. The kids are all different and have different needs. So let's try to get that going. Coordination of care, interdisciplinary teams. Let's get that intervention with a team of professionals with the same goal, outcome. What is that team? Pediatrician, therapists, educators, social workers, anybody who's able to coordinate these goals to achieve those outcomes. We need to actually work together, interact, help the opportunity of that child to get a good outcome. Community resources, access to services. We need to be advocates for our own kids as parents, and we need to use our resources. We need to use our pediatricians, our support groups, our educational programs, everything that we can actually get. And always have in mind to know that having cultural sensitivity, respect the diversity, make sure that we also keep in mind the mental health awareness, the focus on doing this as a community, as a collective, and make sure that we understand and care deeply, because that's what makes the actual difference in anything we do. When you really care and you
Hmm.
support the families, that shows, and success leaves clues. When you're doing something that is working, you can see it. So let's work together. Let's help this family. Let's be there for them, and let's bring back that individualized approach, that one-on-one. That I love my pediatrician not because I have to go and fill up a paper. It's because she asks me questions, because she cares. She knows the name of my dog, and she'll be there for me if I need her as a teenager.
Yeah.
Yeah.
A couple key points you had there: the collaboration, the vision for the outcomes, and the resources. That's part of the reason we started this podcast. And if we had more pediatricians that we worked with that valued that collaboration piece, and for the outcome of the child, things could be even better with the services we provide and how we do things. And then the podcast, that we titled it "Building Our Village," and this is part of bringing those resources to the parents, and bringing awareness that there is other aspects and there are other programs that could help them. So all in general, like that, you embodied our podcast, you embodied our vision with what we do, and I really can't express my gratitude for you coming on and expanding on that.
I am super grateful to be here, and I would love to continue joining you in your efforts to make a difference and make sure that parents know that people do care.
That's
That there's tons of pediatricians out there like me that are ready to be part of their family and be there for them.
fantastic.
Yeah, that's amazing. So, last question, where can people find you?
Well, you can call us
Mm-hmm.
954-866-5688. We're also in social media, Instagram, Allegra Family Pediatrics. We have our website, allegrafamilypediatrics.com, and we're here. Anytime you want to see the boo boo fixer, give us a call. Or
I love that. Well, thank you for being a guest. I think this is a fantastic episode. You brought a lot of value and educational piece to this, and our ability to inform the parents, and when they're informed, they can make better decisions for better outcomes.
Thank you so much for having me. Has been a pleasure. My first podcast with you guys. So
Love it.
I'm looking
Hopefully,
forward
hopefully
to
you'll be a regular guest if we
I
can
am
get you
looking
on.
forward to being a regular with you guys. Definitely will love it.
Thank you.
Thank you.